Hi YouTube world, hi YouTube subscribers. Okay, so apologize for my hair and everything, but I'm in vacation mode because I'm done with nursing school. Until I have to take the NCLEX soon. But anyway, there was a couple things I forgot to mention in the last video for just like nursing school tips. So a couple things. So when studying, a couple things that helped me for the test was focusing on only the diseases they would talk about, there's certain equipment they would talk about, and focusing on what the nurse's role would be. And that's kind of like how their PowerPoints would go. Their PowerPoints would start off with like a category, like neuro, and then it would talk about like different equipment that we would use with the neuro patient, what their symptoms might be, certain disease processes, like diagnostics for that, treatment, and then of course always at the end there would always be like nursing interventions. So know what the role is for the nurse during that. And we also have to know too what the role of like in general the LPN and CNA as well, or the unlicensed assistant personnel is what I think they also called it. But mostly the nurse's role is really important with tests. With tests. And also like knowing which patient you would need to see first, which patient is the most concerning, like things like that. There would be a lot of questions like that on the test, but different depending on what we were studying, whether it was cardiac, neuro, peds, etc. Like what action you should be taking first, what patient you should be seeing first, like what symptom is most concerning. There were a lot of questions like that. Okay, and then what I would use to study, I would use different things. So I would use, in the first block or first semester, I used a lot of the RN Mastery app, and that was really good for me to understand like what the style would be for tests. I didn't really do well on my first nursing test because the style of nursing school test is so different than tests I've taken before. So once I got back my first grade, I was like, oh my god, I cried, and then I was like, how do I figure this out? So then people told me to use that app, and then I used it, and it really helped improve my score, just understanding the style of the test, and then like rationale behind what is a right answer, what is a wrong answer. So I use that a lot, and I use that a lot too in like my in certain subjects, like with OB, they have a section for that, and sometimes for other specialty subjects I would use it as well. I also would listen to some Khan Academy videos. If you're a visual learner, that's really good. But mostly I stuck to YouTube videos. It's called Registered RN, like at youtube.com. I believe is her name. She's like a Southern nurse, and she has so many great videos. Oh my god, she's amazing. There's other ones too that are really good. I can't think of them off the top of my head, but I mostly would watch her videos. But yeah, YouTube is a great resource if you like videos. I would also use my textbooks to reference if I really wasn't getting a subject or I wanted to go more in depth. I would maybe read about that topic, or I would just use it to look at like pictures. And then I liked using Pinterest a lot to help me study for tests. For like diseases, I like the C.J. Miller pictures where there's like a disease process and it has like a picture of what a patient would look like and then their main symptoms, and it's like their symptoms are visualized, so that I thought was really great for me. There's also things like Picmonic. I tried that. I didn't really like it, but it might work really good for you, especially if you're a visual learner. They're kind of like really out there pictures, but I guess that's the whole point. It helps you remember. Some people would use a lot of those NCLEX books. I did use that. I did use NCLEX books for one semester, but for the most part, I didn't really need to. Or I would, if I felt like I did, I would go online and type in Google, like the topic, and then Quizlet. Quizlet is great for, for questions that are NCLEX style, or just giving you, kind of like a summary on a topic. So I used Quizlet a lot, but some people, like I said, really liked using like different NCLEX textbooks. And it's kind of similar idea to the RN Mastery app, just getting used to the style and then getting like the explanations of why this is right or this is wrong. Some people would use the Evolve website for questions as well, to help them. Same ideas like Quizlet. I also would take like the chapter review test at the end of like chapters in my textbook, and they were, I think, even harder than our tests, and our tests were really hard, but I don't know, they were even harder, but I think they kind of helped me understand like the main idea from the chapters in the textbooks. Also, I don't know, there's all kinds of like study resources out there, but the main thing I would do is mostly just studying the PowerPoints like over and over, and along with my notes. But then I would use those other things in addition if I was really struggling, or if I needed to go in depth, or I just wasn't understanding a topic, or I needed like a visual. I would use those other things, but the main thing is the PowerPoints. Oh, and I would make flashcards, and I did like the worksheets that our professors would hand out. And if I didn't have time to do the worksheets, I would at least look at like the answers. Usually our professors would post the answers, to kind of understand like what the rationale behind the answers were. Okay, now going back to being organized, a couple other things I would do is I would put my stuff in my car the night before I had clinical. That way, I wouldn't forget things, because it's always the day you're at clinical when you forget your scissors or you forget your watch. It's the one day that you will need it, guaranteed. So what I did was I bought like cheap versions of the stuff and kept an extra set in my car. That way, if I forgot to like put something on, because you know those clinicals are always at like 5 o'clock in the morning when you're half out of it. So that's what I did to make sure I didn't forget anything I needed for clinical. And I would put my paperwork also the night before in my car. I would print out I'd print out a copy of the care plan, and then when I would go to clinical, I would just write in, as I was talking to my patient, I would write in, like, jot down little notes, like bullets of the head to toe, and like their history, and I tried to keep it in in order, like under the category it was supposed to go in. That way it made it so much easier when I would go back and write my care plan, versus if you have notes with labs on one page and then labs on another. Sometimes that happens because usually when you see your patient, it's like you maybe only get 15 minutes with them sometimes, or half hour, so you're writing like furiously because they have to get to an x-ray, or they have to get discharged or something. But those times when I did try to keep it organized, it made it a lot easier when I had to go back and do the care plan. So just try to get organized. I mean, it's hard to do, but it does save you time in the long run. And then too, you'll catch like if you're missing something because you have nothing filled in, and then you're not like, oh crud, I gotta go back in that patient's room and ask them about this. Like, it's better if you just are organized and do it right the first time. And then something else to keep you organized and everything is show up at least. What I would do with clinicals is I would start arriving 30 minutes early at my last block, and I should have been doing that all along because, like I said in my last video, the one time my GPS gave me the wrong directions, but you never know, like, it's guaranteed you're gonna get in a car accident or have a flat tire or some catastrophe always seems to happen when you have clinical. So I suggest leaving to get there 30 minutes early. That way, even if something does go wrong, you're okay. And I did that at the end, and I think it just, when you show up places early, it kind of helps you get like grounded, and you're just more relaxed when you do that. And then you can get like tips from your classmates or vent or whatever, and then you're like not stressed out starting the day when you're rushing in there. And there were people who would be put on probation because they were late to clinical for the rest of nursing school. So definitely be on time. Try to get to school at least 15 minutes early. One time there was like a car accident near my school, and everybody was late that day, and you know, but sometimes the professors don't care, because truly you should be getting there early, not just right as like the bell rings or whatever. So I missed that entire first half of that lecture, and that stunk. So I recommend trying to get to school at least 15 minutes early. And another thing a lot of people did in nursing school was they started making like a schedule, especially if they had like work and other obligations. They made a schedule like from 5 o'clock till 11 o'clock I'm gonna be mostly studying, and then from 11 to 12 I'll be showering and getting ready for the next day, and between 3 and 5 I'll be at the gym or whatever. I wish I did make a schedule, but I never kept with it. And like I said, I struggle with time management, and hopefully I can get on a schedule someday. I'm a pretty organized person, but I don't know, I've always struggled with time management. My family is really bad with it. If you guys have any tips for me on that, please leave them in the comments below. But I know, I'm just saying, a lot of people would do the schedule thing, and that would help them when they had all these other things going on. But I would at least put in my planner, okay, I have this going on this day, and I made it like way in advance, that way I knew. But I really struggled with the schedule thing. I'm kind of weird too, because I feel like I'm kind of a night owl, and during the day when everybody's getting all their stuff done, I kind of can't seem to get focused until like after 5. So maybe I need to make a schedule for like nighttime, because that's when I seem to be the most productive. Maybe that's why the schedule thing has never worked for me. I don't know. But I need to get better about that. Okay. So anyway, and then another thing I mentioned before, like how I got through nursing school with little funds, was I would save money with different ways. I also would sell like things like when we moved, I sold stuff we weren't using anymore on OfferUp and Facebook Marketplace. Something else I did too, in addition to buying these books, is I would rent books from my school. Especially, like, a lot of students, I notice they get rid of most of their textbooks when they're done. I don't, because I kind of am hoarding my nursing school books. But there were a couple where it's like, oh, this is a specialty I'm not going into. I'm just going to rent it and then return it. And that worked out fine, because you really don't have to have bought, like, your textbooks. A lot of people would just rent all of them, or they would buy older editions, which I did, because they're a lot cheaper, and the only difference is the pages might not match up exactly, but you can look at the table of contents for the topic, and then you can figure out what you're supposed to be reading from that. And I did that, and that worked fine. It's a little more time consuming, but it saved me a lot of money that way. Because some of the textbooks we never even wound up using that much, or you're only using for, like, care plans, but there are some that you're definitely going to need. So yeah. And then a couple things too, going back to those performance tests, something else I would do, I forgot to mention, to keep myself calm, is I started giving myself positive affirmations, because in the beginning I would be like, oh my god, I'm going to fail, I'm so scared, But then towards the end, I started, like, telling myself more like, you've done this before, you've done this with patience, like things like that kind of, like, put me more at ease, like remembering that I can do it, and that I've practiced several times. I might have done it in the clinical setting already, and just telling myself, like, if you can just remind yourself of one thing that you're good at, like, everybody has strengths and weaknesses, but if you can just remind yourself, like, oh, I'm really good at educating the patient, or I'm really good at doing skills, or I'm a good note taker. Just remind yourself of those things during tests, or when you're doing those performance tests, and that helps you. It doesn't help you when you're negative the whole time. In fact, I know some people that they failed because they would just freeze up or whatever, and you just have to keep going. Like, when you're doing a performance test and you screw up on something, like, verbalize that you screwed up something, and then say how you're gonna fix it, and then you gotta move on. You just gotta keep going, because even if, like, I've had some tests where I told myself, oh my god, I'm gonna fail, and then I just kept going, because I'm like, well, it's not gonna be for lack of trying. And sure enough, sometimes I would pass, even though I had, like, all this nervousness and everything. So don't let yourself get so flustered. Like, you have to just keep going. Even if you make a mistake or whatever, just verbalize it, and then you gotta move on. That's it. You can't just stop or whatever. You gotta keep going, or you will fail. And then another thing is, some people wouldn't take those performance tests seriously. Like, they would not even study or practice, and they would fail, and then of course you have to redo it if you fail, and then they would continue to not study or practice, and then guess what? They would fail the entire block. But as long as you study more, you figure out what you did wrong, you're gonna pass. So I'm just saying that, because don't think, oh, these things aren't important. Like, everything is important in nursing school, so take everything serious. Even if it's not a written test, like, they're kind of watching you do everything. Like, whether it's clinical, I know people goofed off in clinical, and guess what? They didn't make it. They would, like, disappear or whatever during clinical, and they keep a close watch on us. So don't think you can slack off wherever it is in nursing school. And another thing with clinicals too, and being organized, is set multiple alarms when you have a test or you have a clinical day. I almost slept through a clinical day one time, and by the grace of God, luckily my husband was awake for whatever reason that morning at like 4 o'clock, and it woke me up, and then I realized, oh my god, I have a clinical day, because I had kept hitting, I hit snooze, and somehow I would like hit my alarm off that day. But anyway, I just barely wound up making it to clinical on time. So what I had to do was I had to set my phone like across the room from me, that way I wouldn't just keep hitting snooze or accidentally hit my alarm off. And I made sure to set like 4 or 5 alarms if I knew I had a test or clinical. That way I knew for sure if I shut one off, I had another one. Or some people, because I feel like everybody at one point almost sleeps through something important during nursing school. So some people, they would have a friend who would carpool with them that would make sure that they were out there that day, like, calling them or whatever, to make sure they didn't miss a test or anything. And as far as the performance test goes, I was talking about earlier about not listening to people who are being super negative. So I did have friends in nursing school who were negative and just over anxious about things. So what I would do is, if I knew we were having a test or a performance test that day, what I would do is I would like mute their messages to me until afterwards. That way it didn't start like messing with my head and making me nervous. So do whatever you have to do to kind of like ignore people that are being overly negative, especially the day of like something important. Okay. And then another thing too, like one more thing. Okay. So getting back to like making sure you're also keeping your support system happy and to a degree, and showing that you're appreciative of everything they're doing for you, and making sure you're spending time with them. So sometimes like I would only have like 30 minutes a week to spend with my husband. I would try to do a day where we would spend time together, and sometimes that just wasn't realistic. So it would be like, oh, we get to watch a show together this week. As long as you have some time, and sometimes it would just be, I'd be studying in the same room as him while he's like playing a video game or whatever, because you really, relationships take time and effort just like everything else. So make sure even though you're super busy in nursing school, somehow you're still spending some time together, even if it's not like ideal, like you're studying or whatever. That's still like you're putting in some effort, or if it's just you're going out to eat like once a week, that's still like putting time and effort into it. And then as far as like making friends in nursing school, I definitely encourage it, like I said in my last video. And you don't have to be best friends with everybody. I don't recommend forcing it with people you don't get along with, or people who are really like gossipy or catty. But definitely try to find people who you at least have something in common with, like, oh, you both want to work in OB, or you both have kids, or you live in the same area. Whatever it is, try to find people who have something in common with you, and that's how like I made some good friends in nursing school from that. And yeah, that's pretty much it. Okay, so if I think of anything else, I'll post it. But till then, just leave me questions, comments below. Don't forget to give it a thumbs up if you like this video, and please subscribe.